Qualified, professional, and compassionate doctors talking real solutions to real health problems.
This message is from the Ministry of Health with support from partners.
Good evening, esteemed viewers, ladies and gentlemen. We welcome you this evening to yet another riveting episode of the DOCtalk show, brought to you by Quiz Mali Productions and proudly sponsored by the Ministry of Health and its partners. I am Dr. Muyanja Andrew, your host tonight on the world of medicine. And tonight, we are discussing liver disease in HIV. Did you know that out of every 100 people you meet, 6 of them may be having HIV? That comes to a figure of about 1.2 million Ugandans who have HIV, and this is only for those within the age of 15 to 64 years. I can also speak with authority that you who is watching me may be knowing someone or even may have lost someone to HIV. And therefore, this is a discussion which should not be in whispers, but which we should have openly. Tonight in the house, we have a special guest, Dr. Doreen Nanyunja from Naguru Hospital, and I'll request her to say hi to the viewers out there.
Thank you, Doctor. Good evening, viewers. As he has introduced me, my name is Doreen Nanyunja. I'm a physician at Naguru, better known as China-Uganda Friendship Hospital, Naguru, where I work in the internal medicine department, and I'm happy to be here.
Thank you so much, Dr. Nanyunja, for sparing time to come and share with us your hard-earned knowledge. We really appreciate that gesture. We would like maybe to start from a point of helping my grandfather or father out there to understand, first of all, what the liver is in itself, and maybe what it does, for us to really spend our time to even discuss about it tonight.
Yes. All right. So the liver is actually the largest internal organ that we have in our bodies. It's an organ that does very many things, but mostly it helps us get blood. It collects blood from the digestive system, and that blood has nutrients, and the liver's role is to process the nutrients so that they are usable by the body. Okay. Outside that major factor, it also does other things. For example, it stores the nutrients that you've not used. When you've eaten food and you're full and your body has used the energy it needs, the liver will store the extra energy within its cells. It also will store vitamins, but it also has a role where it produces things that your body needs. For example, it will produce factors that help your blood to clot or to help your blood not to bleed excessively when maybe you get an injury. And that's one of the roles of the liver. It also has a function where it helps your body fight off infections that may come in through the bloodstream, maybe from your intestines, and they've made their way into the blood. The liver will mop up these germs, and so that they don't get into other parts of the body. So those are some of the functions that our liver plays.
You know, when you were talking about the different functions, I have been thinking about what could go wrong in case it actually has an issue. You talked about digestion.
Yes.
You talked about the issue to do with it helping to produce certain factors which are important in clotting.
Yes.
You talked about it playing a key role in our immunity.
Yes.
And so I imagine that if this organ somehow had an issue,
yes,
I'll have probably issues to do with digestion, issues to do with my immunity, issues to do with clotting of blood and so on and so forth. Interesting. So we have talked about all this, but the topic tonight is liver disease in HIV. How do these two topics connect. How does HIV affect the liver?
Yes. The reason actually why we focused on liver disease in the context of someone living with HIV is because we've noticed as we work with different patients, we've noticed that very many people have a lot of information because there's a lot of publicity about HIV. But sometimes this large organ that's in our bodies may not be that, people are not that knowledgeable to find out how HIV is affecting it. And yet, as I've told you before, it's doing a lot of work to help stabilize our bodies to be in normal functioning. So the reason we actually wanted to highlight what happens to the liver in a person living with HIV is so that we can give you more information so that when you get an issue, this liver that you have, and it's a one organ that you have that doesn't have, it's not in duplex because you have 2 lungs, 2 kidneys, but you have only 1 liver. So if it gets damaged, chances are that it's the only one you'll have and it can lead to an early death, even if you're taking your medication. So how HIV affects the liver is in very many ways. Like I said, the liver is one of the organs that helps us, our bodies fight infections through its immune function, right? Yeah. So HIV is human immune deficiency virus. It's a virus that will lead your body to have a low production of the immune cells that we need to fight off infections. Mm-hmm. So when we are not fighting off, when the HIV affects our immune system, it directly affects the liver because now the liver's role of immunity is also affected. Mm. How is it affected? The HIV will reduce the cells that the liver is also using to fight off these bacteria that come in. And because of that, the liver now starts to get damaged because it also can't fend off these infections that come in. That's one way. The other way is because when you're HIV positive, you're put on medication to help your body fight the HIV infection itself. Unfortunately, some of the drugs that we have, that we use for our HIV treatment, can also directly affect our liver. Some of these drugs are good in the HIV, but their side effects impairs the liver to an extent where the liver itself now gets damaged. Some of these drugs also include drugs that we give for patients with TB, which is also one of the commonest diseases that we see in patients living with HIV. The other way that HIV can affect the liver is when you get any other infection, because your body's immunity is low and is not able to fend off enough of these infections, those infections are more aggressive in your body. And some of the infections that directly affect the liver, for example, the viral hepatitis, like hepatitis B or C, will progress much faster in someone who has HIV than someone who just had the infection without the HIV in their body.
You have talked about the HIV in and of itself,
yes,
affecting the immunity.
Yes.
Therefore, the liver, which has cells like any other part of the body,
yes,
will not be able to be well defended,
yes,
and will be damaged. Then you have talked about some of the drugs we use in managing the HIV itself, and even in managing some opportunistic infections such as TB.
Yes.
So HIV comes, makes your body weak.
Yes.
You end up with hepatitis B, hepatitis C, and so on and so forth. Dr. Nanyunja, we thank you so much for that, but allow us to have a short commercial break, and we shall be right back to continue this discussion. Thank you.
This message is from the Ministry of Health with support from partners.
You are watching the DOCtalk show.
Amanya gange nze Namtebi Sharon nga nkolera wano wennyini Saka Kirombe oba Makindye. Empangula gye nawanguddemu ssente mbadde nga nkozesa mobile money nga nsindika school fees w'omwana ku ssomero. Okutegeera nti mpangudde, nze mutima neegambye nti kambalinde bamale okujja ndyoke nzikirize nti mpangudde. Kyennyinza okubagamba nti si byabafere, weewaawo abafere gye bali, naye ennamba eri emu yokka era bw'eba ekukubidde omanya eyo si yabafere. Mpulira bulungi nnyo 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 era ndi musanyufu nnyo. naye MTN mobile money mbebaza nnyo mwebale nnyo mwebalire.
Together, we're unstoppable.
You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
Welcome back from that short commercial break. This is the DOCtalk show, and the topic of discussion this evening is liver disease in HIV. Allow me to remind you that we are streaming live on YouTube, but you can also send in your questions via the number displayed on the screen or via our Twitter handle. Dr. Nanyunja, so you took us through basic descriptions of what our liver is, of what it does. Then you also took us through how HIV affects the liver. What signs and symptoms can someone base on out there to know that, yes, I have HIV, but my liver may be compromised?
Yes. Okay. Thank you, doctor. Just to remind ourselves of the functions of the liver, we say that the liver does functions of immunity. It stores the food that you've eaten in form of something that can be used for later energy. It helps to detoxify the blood. It also has a function of producing clotting factors as well as storing vitamins. So of course, when someone gets sick with liver disease, the effects of that we are seeing in the presentation are from the lack of function of the liver. So you'll get patients who all of a sudden come in and they say, I'm always tired. So one of the commonest presentations is constant fatigue. They may be sleeping all the time. They don't know why, because they do not have energy. And then as the liver progresses, then they may start noticing that their eyes are turning yellow. It's because the liver is not able to detoxify the blood, and so the toxins or the bad substances that should have come out remain in the blood. So it may present with turning yellow of the eyes. The skin can get yellow and then itchy. You may also notice that your urine is darker than normal. It may be dark yellow, even tea-colored. The stool may change. It can either become pale, or you may even see dark stools, and that may be a sign that you're bleeding internally. The other thing that you can know that your liver is now damaged, you will lose weight even if you're not on any weight loss journey. But after the weight loss journey comes in, as the liver is progressing, then your body starts to swell, because now it's retaining excess water. So sometimes you will notice people saying, I initially lost weight, but all of a sudden I see my stomach is getting swollen, my legs are getting swollen. And these are usually are in more advanced stages of the liver disease. Okay. Yes.
Interesting. So you have talked about, I don't have energy.
Yes.
I am having issues. But what of the bleeding itself? You talked about bleeding internally.
Yes.
But can I develop tendencies to bleed more than normal, even externally?
Yes, because your body is not producing the clotting factors. You can even go for a simple lab test. They prick you and that place doesn't stop bleeding. Yet usually after like 2 minutes for normal people, the bleeding will stop. So if someone gets abnormal bleeding, or as you're brushing your teeth, you notice you're bleeding from your gums, which is usually not there. Or you can even just get bruising under your skin. You see patches under the skin where it's becoming like someone has hit you and then there's blood under the skin. So those are some of the ways you can know that I'm easily bleeding.
Now, when you were talking about the toxins, personally, as someone within the field of mental health,
Yes.
I thought about what these toxins can do to my brain.
Yes.
That, yes, you have the yellowing of eyes and all that, but these toxins as well can actually reach my brain.
Yes, they can.
And someone ends up becoming mentally ill, if I may put it that way. What we, Dr. Nanyunja in their field, what they refer to as hepatic encephalopathy. Yes.
Yes.
Interesting. So after doing all this, I have come to you, maybe I have yellow eyes, maybe my skin is itching, or I have been bleeding easily, or maybe I have yellow eyes, but they brought me in, I am moody, I am undressing, I'm doing what? How would you go around clinically to diagnose me and know that the issue you are having is not because of kidney disease, is not because of a primary mental disorder, but it is because your liver is actually diseased.
Yes. Thank you. As someone living with HIV, remember you are most likely on a number of medications. You might be on new ARVs. Your doctors might have put you on maybe medication to prevent TB or even TB treatment. You might be on other medication for other common illnesses. So as a health worker, I would first try and get more history. What drugs or medications have you been taking? And this can include those prescribed by the doctor or those that you have bought from a pharmacy or a drug shop in your neighborhood. However, we also know that in our setting, very many patients tend to want to also use herbal medication to supplement their usual medication. And as health workers, we always want to know. And it's important for patients to be very open with us to tell us that, you know what, I've been using this plus this on the side. Because sometimes what you're experiencing could be side effects of our medication that we gave you or any other herbal use that you've had. But we also remember that we're also in an era where we're living with people who have substance use disorder. So some people may be taking illicit drugs, and as a health worker, I would want to probe on that. Sometimes it may not come out immediately, but some of these medications and illicit drugs may be what are harming your liver. The other thing that I would want to find out from our history is, do you have any other medical conditions? Yes, you might have HIV, but you could also have known to be having hepatitis. You could be having diabetes or any other illness for which you may or may not be taking medication. So a history as you come in is very important because it gives us an idea of what could have been causing this injury in the first place, if it's not just the HIV itself.
So besides history,
yes,
what else would you do or do you do for us?
So as patients come in with us, we start by our history and then we examine the patient. So we'll ask to have a look of your body head to toe, because as we said, the manifestations of liver disease can be anywhere. Like doctor said, your mental health is also can be affected. So we'll try and do a mental health exam to see if you're able to actually give us the information that we can. Some patients are not in a state where they can actually communicate. So we rely on their attendants who have brought them in to give us more information. But if the patient is able to communicate, we use that. And then we'll examine you, look at your eyes, because jaundice will likely present as yellowing of the eyes. We look into your mouth. Then we can still examine your abdomen. Most times, if your liver disease is advanced, you will have a swollen abdomen, you will have swollen limbs. And if it has just started, the liver may have enlarged to a point that you can even feel it when you touch the person. However, as the liver disease progresses, the liver tends to shrink because of the scars. And then the spleen, which is on the opposite side, may also now be what is swollen because of the increased pressure in the abdomen. So those are some of the things we look at. After we've done our physical exam, then we shall do some blood tests. Okay. Most health facilities are able to get blood work done for patients who have come in with liver disease. So in our blood tests, we are looking at whether there's damage to the cells of the liver, and also we are looking whether you have missing nutrients or factors in your blood that could be causing the symptoms that you have. The other thing that we can do, which is also commonly available in most health facilities, we can do an ultrasound scan. The scan will help us see that if your liver is looking okay or if there are any abnormalities in the liver. The abnormalities on the liver can be in form of the shrinkage, like I've talked about, what we call cirrhosis, which is really scar tissue in the liver, which makes it shrink. However, as time progresses, and I'm going to talk about that in the complications, we may now start seeing maybe swellings on the liver, which could be tumors, or even, like I said, the spleen can enlarge, and that can be seen on scan. We can do an ultrasound scan. We can also do a CT scan or an MRI for these patients.
Okay, wonderful, wonderful. Maybe what we could have forgotten is we talked about the different tests, but we also need to remember that within the context of HIV, we are at a high risk of getting hepatitis B, yes. So we shall check for that, probably hepatitis C, and any other opportunistic infections we may think may actually affect the liver. Yes. Allow us to have a short commercial break, and we shall be right back to continue this discussion. Thank you.
This message is from the Ministry of Health with support from partners.
You are watching the DOCtalk show.
Hey, business people of Uganda, the Ugandan National Lottery is here for you. It's the perfect opportunity to boost your business. Zimba your business by becoming an authorized Uganda National Lottery agent. By paying a security deposit of just 250,000 shillings, you will receive your very own Uganda National Lottery terminal, expert training from the pros themselves, and marketing materials to skyrocket your sales. And with a generous 5% commission on every ticket sold, the potential for earnings is limitless. Don't miss out. Act now and call us toll-free at 0800 33 44 33 to see if you qualify. Join us today and Zimba your business. Ituba Uganda is regulated by the National Lotteries and Gaming Regulatory Board.
You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
Welcome back from that short commercial break. This is the DOCtalk show. We are streaming live on YouTube, but you can also send in any questions you may be having via the number displayed on the screen or via our Twitter handle. Our guest in the house tonight, Dr. Doreen Nanyunja, has ably explained to us a lot about liver disease in the context of HIV, and the last issue we tackled before we went for the short commercial break was about how you can know if you actually have liver disease, where she talked about you having maybe yellowing of the eyes or the skin, talked about bleeding tendencies, talked about a number of other symptoms. As well, she helped us to explore the different ways in which medics can diagnose liver disease within the context of HIV. Dr. Nanyunja, having explored all that, what possible complications can we encounter if we have liver disease within the context of HIV?
Yes. So some of the complications are related to the disease itself, while some are related to the medication that the patients may be on. I'll start with the complications related to the disease. Once you have liver disease from any cause, it can be from the viral hepatitis, it can be from alcohol, it can be from herbal medicine use. Once you have it and yet you have HIV, the virus in your blood, HIV itself will make the damage to your liver much faster because it's an immune inflammatory condition. Inflammatory means that the cells are constantly getting damaged because of the HIV being in your body. So unlike someone who doesn't have HIV, the disease will progress much faster in you who has HIV compared to someone who doesn't have. So the complications will even manifest faster. For example, if you got hepatitis B today, the complications of hepatitis B will probably manifest a year later compared to someone who is HIV negative, where it can even take 5-10 years for them to start seeing that they actually have hepatitis B. So how would these complications show in our bodies? Because of the liver disease, when the liver starts to get damaged and it's not functioning well, you will present with, like I said, the clinical presentations that you have. But some of the complications that patients tend to get are, it can progress to cancer of the liver, which you call hepatocellular carcinoma. Once you have, especially this is common in patients who have both HIV and hepatitis at the same time. Hepatocellular carcinoma, once it affects your liver, will present as a swollen liver, which is very painful. So you'll feel pain, especially in the right upper part of your abdomen. And then you can also get easy bleeding. So complications can be someone coming in with vomiting excess amounts of blood. And this can mean that maybe the blood vessels in their stomach, because of the pressure in the abdomen, have opened up and the patient comes in with severe vomiting. So they can say this patient had liver disease, but now they are vomiting blood or passing very dark stool or even frank blood in their stool. The other complication, like I said, is swelling of the body, which we normally call ascites. And that ascites can get complicated in that bacteria can move from the intestines, enter that ascites, and the patient comes in with severe pain of their stomach, and it's because of an infection that has now spontaneously happened in their stomach. The other complications that patients tend to get are the mental complications. Like we said, hepatic encephalopathy is when these toxins should have come out of your body, maybe through the stool or the urine, accumulate, and then move to the brain. And then the patient gets, initially they will have excessive sleepiness, then no sleep at all. Then they will start fighting. Sometimes if people are not able to identify that it's a liver, they will take them to a mental health expert. Yet primarily it's a liver causing all this. So those are some of the complications of the disease. Then on the side of the medications that we give can also come with complications because the liver is not able to break down some of the medications, even common medications like Panadol, which is common in our shops and people usually buy it. Because it's usually broken down by the liver and eliminated, if you take Panadol for maybe malaria, sometimes you can get toxicity or toxins building up from just that Panadol because your liver is not able to remove it from the blood. And this can happen with any other medication. So you get side effects of the drugs, which can be rashes, bleeding, wounds, or things like that because of the liver damage.
Wow.
Yes.
You know, when we were talking, you mentioned something and I felt a lot of shame by virtue of the fact that I forgot alcohol.
Yes.
Alcohol. We are aware that HIV, having a diagnosis of HIV in and of itself is stressful.
Yes.
And one of the maladaptive means some people use is actually consuming alcohol with the hope that it will help them maybe forget their troubles, or it will ease the pain they're experiencing. But in the process, as you are taking the alcohol, yes, you are getting the sleep, you are also taxing your liver. At the same time, you are taking ARVs, some of which are taxing the liver. So when you have these factors interacting, definitely you'll end up with liver disease. But I'm grateful that you managed to remember that and mention it.
Yes.
So yes, someone has come to you, they have presented with all this. How do you manage them?
So the management, of course, when someone is very sick and they have come to the hospital, we usually start by managing the complications that I've mentioned. In the initial phase, you want to stabilize the patient. If they are bleeding, we'll try to get them blood for transfusion. If they have very much water accumulating in the abdomen, we do what you call ascitic fluid tapping. We basically put a needle through the abdominal wall and remove that excess fluid so that they get some relief, because it can cause a lot of distress when it accumulates. And then we give them antibiotics in case we've detected that there is an infection. Obviously, in all this, if a patient has been on drugs or medications that we think are causing damage to the liver, we withdraw them for that time. Some we may withdraw permanently, some we may hold, and then maybe restart them later if we think they are still important for that patient's health. So our management will include stabilizing. We look at what medication you've been on. We can keep some, we withdraw some, and then we can give you medications to help the liver regenerate. Sometimes we can, if it's not too late, there are some supplements that patients can get, which are prescribed by doctors, that can help the liver regenerate as you are withdrawing whatever the initial injury was. However, in a patient who is on HIV medication, remember that HIV continues to multiply. So if you sense that what is causing you damage is the drugs that you're on, we always refer you to the HIV experts, to the clinic where you've been getting your medication, and we inform them that this patient is on ABCD, but we think it's causing damage to their liver. Please change, because we have a number of options nowadays. And so we can withdraw the drug that we think is causing the issue, and then it's replaced with something else.
Do we currently have the possibility, because the liver can get diseased to the point that it's not functioning, do we have a possibility of maybe someone donating to me a liver or something of that kind within our context? Or is it happening out there anyway?
So out there, liver transplants are happening, and it's one of actually the easiest things to get, because to get a liver, you do not need someone's entire liver. They can donate to you a segment of their liver, and they remain with part of their liver, and you get a segment of their liver. So out there, it's happening. In Uganda, I'm sure we are soon starting liver transplants, because I think we are just waiting for the committee, the transplant committee, to be, I think, formalized so that people can now start doing liver transplants. And I think centers in Molago and even some private hospitals already have trained surgeons who can do this. So there is hope for someone whose liver is damaged beyond repair. If they are able to, they can easily get a transplant, and usually they can get it from a living donor who doesn't have to forgo their entire liver. They can just donate part of their liver to you, as long as it's something that you've been assessed by doctors and they see that you're fit for a transplant, because the transplant will come with immune suppression, because we don't want you to reject the liver that you're getting. Yeah. So sometimes they will assess you and then see if you're fit for a transplant, and if you are, and it's available and the funds are enough, I think people can be able to get organ transplants. But for right now, most of our patients, we are doing more of the conservative management with what we can give. And some people really have a good outcome.
Okay. That's wonderful. We thank you so much for the work you are doing out there. Our viewers out there, from what you have heard from Dr. Nanyunja, being diagnosed with liver disease in HIV is not a death sentence. You can still get help, you can still be managed, and you continue living a productive life. So please, if you have seen someone, know someone, or are that someone with the symptoms we have talked about, or even complications, please seek help as soon as possible from any government facility near you. Allow us to have a short commercial break, and we shall be right back to talk about how we can prevent liver disease in HIV.
This message is from the Ministry of Health with support from partners.
You are watching the DOCtalk show.
Hi, my name is Rachel Nduhutiri, and I am a Ugandan actress and the winner of the Africa Monologue Challenge 2023. Now, thanks to your immense support, the Africa Monologue Challenge Season 2 is coming to Uganda between July 25th and August 20th. Africa Monologue Challenge is looking for passionate Ugandan storytellers to take part in a Pan-African short film that will showcase Uganda to the rest of the world. To be a part of this, all you have to do is weave a captivating narrative that captures Uganda's cultural heritage while fostering connections between 10 diverse individuals from 10 African countries. This short film will be shared to over 50 film festivals. Now, to find information on the AMC 2024 finalists, visit www.africamonologue.com. Please submit your short script, which should be 10 pages for a short film between 10 to 15 minutes, to africamonologue@gmail.com before 30th June 2024. Now, let's talk about rewards. The selected script will have the writer's full name in the end credits. You will get a chance to collaborate with amazing filmmakers from all over the world. You will get a small token for your creativity, and you remain with full ownership of your script. Let's work together to create a Pan-African film that will echo African stories throughout the world.
You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
Welcome back from the short commercial break, and this is the DOCtalk show. Tonight we are discussing liver disease in the context of HIV. The guest in the house tonight, Dr. Nanyunja, has shared with us a number of insights, and last we talked about how within the hospital setting they manage liver disease. We have grown up knowing that prevention is better than cure. And actually, when you further analyze it, you realize that it is even cheaper than cure. How can we prevent ourselves from developing liver disease, even when we have HIV?
Yes. So prevention will be in two arms, on the side of the health workers and then on the side of the patients. We as health workers have a duty to patients who have HIV, who are living with HIV, to inform them about the different components of their treatment that can cause liver disease. Like I informed you earlier, we have medications that are important for their HIV or the other co-infections that they have that can damage the liver. So as health workers, we need to be continuously screening patients. For example, if I'm on a medication, I can tell you every 6 months come in for routine screening. We can do some blood tests, we can do a scan to make sure everything is okay. Let's not wait for complications to occur. The other way we can prevent liver disease from developing in these patients is after you've screened, you also have to advise them on modification of their lifestyle. On the side of the patient's lifestyle modification is very, very key. We say that HIV can cause people to want to drink, they can get into risky behaviors. So they may think because I have HIV, I don't need to use protection, but you can get hepatitis through sexual transmission. So we need to advise our patients to protect themselves, use protective methods when they're engaging in, and also to have risk aversion, because they can still get other viruses that are not HIV that can affect their liver. Also, drug use is very common among our young people, so avoiding illicit drugs, avoiding use of over-the-counter medication without informing your doctor. Because you may think, I have constant headache, let me keep buying my Panadols, and then the Panadol itself is what is going to cause the damage. And then herbal use, much as it's contentious, people want a herbal medication. We are not 100% against herbal medication, but you know that some of it is not regulated. So if you're going to start using herbal medication, some of it may cause damage to your liver. So it's always good if you have supplements to inform your doctor that I'm using ABCD, and they can advise you accordingly, because sometimes you don't even need some of these supplements, but because people are advising you that I tried this, it worked for me, so please use that. So also that, and plus lifestyle diseases can also affect the liver, like preventing diabetes, hypertension, and things like that. So always living an active lifestyle, doing your exercise, minding what you eat is also very key in preventing these diseases from coming in someone who already has HIV.
Okay. You were talking about that, and I remembered the, I don't know how to call it, it's a saying in the public domain of late, to drink till you paka kuwulira bubi. So if you have been out there and you drink till you kuwulira bubi, then this is a wake-up call for you that as you are kuwulira bubi, you are also messing up your liver.
Yes, yes.
Especially within the context of HIV, in case you have HIV and you are stressed.
Yes.
Please approach any health worker out there and inform them about what you are going through. If they cannot or do not have the expertise to help you resolve what is going on, they will refer you to a counselor, they will refer you to a psychologist, to a psychiatrist, to a psychiatric clinical officer, to help you process the pain or the anguish that you are experiencing because of having contracted HIV. But please do not resort to taking alcohol alone. The other issue, Dr. Nanyunja, which I've remembered is I have worked in the context of HIV before, and these colleagues usually have headaches.
Yes.
A lot. And some resort to self-medicating, and guess using what? The most common drug we know around.
Yes.
That is paracetamol.
Yes.
So I have a liver that is already damaged. I am on HIV medications. Maybe I have TB, and now I am also self-medicating with paracetamol maybe 5 times a day.
Yes.
And we crammed the 1 gram TDA. 1 gram is the minimum we think we should take. So in case you are having persistent headaches, please do not self-medicate.
Yeah.
Panadol is not as innocent a drug as we think it is. It is processed through the liver and can also damage it if it is not used properly. Having talked about all this, in case I have liver disease, where can I seek help?
So with liver disease, if you're just getting the symptoms, for example, someone notices that your eyes are yellow, but for you, you're feeling okay, you can go to the nearest health facility. both government or private, they will take off some blood work, like I said, and then if they find that you have maybe any other infection, for example, hepatitis, they can refer you then to maybe our government hospital, district or regional referral hospital, where we have specialists who are trained in liver disease management. Because with the initial phases can easily be managed at the lower health facilities. But as the liver gets more damaged and needs more advanced care, I would advise that you seek a bigger hospital and you seek to see a specialist, for example, a physician or even a hepatologist, but those are not very many. But a physician can be able to help you walk this journey. We usually want patients who come to us earlier than later, because sometimes people will say, I went and they did nothing, but sometimes it's late referral to the health facilities. So the moment you do that initial screening and they tell you there's something wrong with your liver, please come to the nearest health facility, and then they could refer you to a more specialized facility. For example, the region, like in Naguru, we run a hepatitis clinic every Tuesday and Thursday. So you can come and the medications are available. So if you have hepatitis with HIV, we still can give you medication for that. If you have an alcohol use disorder that is affecting your liver.
Dr. Doreen, you said every Tuesday?
And Thursday.
And Thursday.
Yes.
Okay.
So we have a clinic that runs and we have the medication for these patients. Okay. And this is just what is nearer, but even all regional referral hospitals, even the national referral hospitals have these specialized clinics where patients can go with advanced liver disease, and they will be able to have doctors review them, manage them, and continuously follow them up. It's not a one-time disease because this is chronic, so it's a place where you have to keep going for the doctors to review you.
Okay, wow, thank you so much. So the viewer out there, I hope we have understood that these services are available, not within only private facilities, but even within the government facilities we have, and can be managed. Dr. Nanyunja, what parting shots do you have for our viewers out there?
Yes, thank you for having me today. But I would also want to emphasize for our viewers, having liver disease and HIV is not a death sentence. Like we've said, let's avoid self-medication.
Yes.
Let's seek help at the earliest. If you have a substance use disorder or you're struggling with alcohol, we have very many specialists or health workers, even at the lower health facilities, who can counsel you and then support you on your journey, because it may be hard for you to quit. The other thing, while you are adherent to your medication, remember that our medications can also have some side effects. So always go for your routine visits. Don't say that my HIV is okay, I don't need to go back to the hospital, I'll just pick my drugs and go. At least every 6 months, go for a routine checkup. That checkup may be the one thing that's standing between you and advanced disease that may not be cured. So let's get into the habit of going for routine checkups, even when you're feeling fine.
We thank you so much for having spared time to come and share with us those insights. To the viewer out there, prevention is better than cure.
Yes.
Liver disease in HIV can be prevented by not getting HIV as well in the first place.
Yes.
So let us remember the ABCs. A for abstain, B for be faithful, C for use condoms. If you cannot use or apply the first two, let us always remember the ABCs, prioritize our lives. This has been the DOCtalk Show.
This message is from the Ministry of Health with support from partners.
UBC, inspiring Uganda. This weekend on UBC.
UPDF has an engineers unit in each of the army divisions across the country with the capacity to undertake any major government contracts in the country.
We constructed it following the descriptions by means of health. All these are solid concrete blocks, roofed with the steel members, with 26 gauge iron sheets. So these are standard buildings which will last longer and longer.
Very happy as a district with the works being done by the UPDF, and we hope to continue the cooperation.
But Maziwa is a unique site. As you have seen, the other bridge, a heavy truck can't cross. We would bring sand, stone dust, blocks, and we offload from that bridge.
The brigade is vital to the country's growth since it engages in a range of initiatives, including building projects, combat and civil military cooperation.
We get these small vehicles of 3 tons. We reload and deliver here. We have mastered the terrain, and that's what makes us, as UPDF, tick.
We have done a lot of